Welcome to another episode of Dentalflix Uncut, where we get to interview some of the most creative, most intelligent, most experienced creators, dentists, and educators in our industry. And today I am with somebody who is very, very experienced and very, very helpful in our industry. We have Dr. Moorhead. Welcome to Dentalflix Uncut.
Thank you, but you say that about anybody you interview because that's what Dentalflix is.
Well, I chose a specific word for you, which we're going to dive into today because you have done a lot in your career. I remember listening to your bio for the very first time and I was like, what? You have done so much. And then the other thing that I really think is quite special about you is that you're also just a very, very nice person. Sometimes we have very accomplished people that aren't as nice as you are. So I would say that I'm going to say very specific things about you, because truly Dentalflix is about showcasing the creators and the educators in our industry in a real and genuine way. So
I have
welcome.
an easy rule, treat people like you want to be treated.
And I think that is such a key and tie into exactly what we're going to be talking about today. So give our audience just kind of a little bit more about who you are. Who are
Okay.
you? How do you help our industry?
I am a practicing dentist full time, 4 days a week still. I've practiced for 43 years, which makes me 37 years old if you do the math. I have for about a decade now spoken in dentistry on three areas: dental fear, medical emergencies. Those both go with teaching IV sedation, and I am co-partner in a group that teaches IV sedation to dentists to get their moderate IV permit. And then I also have a passion for SOPs. And if you have time, I'll tell you how I got into that. But bottom line is, I really want to change the paradigm that we have in dentistry, where we think that we have to have it all up here. Medicine learned 10, 15 years ago to use checklists to error proof, and it transformed their industry. They took a model like aviation. I mean, in my elevator speech, I admit it's the elevator speech. Um, Dentist, assistant, hygienist, you're sitting on a plane. You hear the flight attendants say that the pilot and the co-pilot are in a rush and they're not going to run their safety list. Are you going to stay on the plane?
No,
Heck no. But that's the way we run dental offices every freaking day.
it's
I
so
want
true.
to change that.
I love that. I absolutely love that you want to change that. And because Dentalflix Uncut is really about like understanding more of like who you are and like why did you start this and the story of your kind of origin of becoming an educator on this? Why did you want to start this? Like what was that story?
Life-altering response situation in 2009, and I remember it like it happened last week. I had a patient in the chair. I was doing IV sedation. That then I had done oral for 9 years. I had just certified in IV sedation 9 months before, and I had Joe in the chair. He was 72 years old. It was an ideal situation. He had come in the previous week in pain. Doc, you just gotta help me. And the only reason he showed up was his wife made him come. But he had a lot of teeth that needed to come out that could not be restored. We scheduled him that Monday morning, went over the consent forms. He followed every instruction perfectly. Those older patients are more sensitive to the Valium-like drugs, so I knew to go slower, and I did. But his pulse oximeter came down as he wasn't breathing as well. I tipped his head back like we're taught in basic life support and reached for the oxygen. The oxygen did not come on. And I got kind of panicky. We were radios. I was not nice. I radioed, somebody didn't turn on the oxygen this morning, get it on now. And what seemed like an eternity, maybe it was a minute later, they come back and say, Doctor, all the oxygen tanks are empty. And so were the emergency tanks. And I panicked, which you never do in an emergency. And the patient was getting worse and worse. The savior of the day was my front office assistant that took me out and said, Doctor, you're not accomplishing anything by lashing out. And I got my wits about me and I had a reversal agent. Duh. I had him breathing again in a half minute. There was no problem. I even was able to finish the appointment. But that was a wake up call.
Oh my gosh, I got goosebumps. That the goosebumps are still here. They're not going away. Oh my gosh, I can only imagine. So it's unfortunate, I think, that sometimes our biggest disappointments are our biggest like fear moments are the ones that catapult us into making change. But actually, I love that you did something really powerful with that. So, what happened next? Like, what was your next kind of move inside of your practice? Like, what changed?
We started implementing the aviation model and doing the checklists. And as I got into it, I saw more applications for more than just medical emergencies. I saw that it could change how we're doing things to where things were more predictable, more efficient, more profitable.
Mm-hmm.
And I have found out since pandemic, it makes it, we're having a real hard time right now. This was filmed in 2024, and we're having a hard time all across the country finding people that'll work in our offices.
Yeah.
But we tend to look for people that have worked in a dental office. The norm has been that it's taken 4 to 6 months to get them to where they're competent. If you use the extensive checklists, you can do it in 4 to 6 weeks.
Yeah.
And I've done it over and over again.
Yes. Oh my gosh. I think like anybody listening right now who's had to have trained a new staff member, a new team member in the last 6 months, which I think is majority of the
Most,
practices.
yeah, yeah, yeah.
Yeah. They can relate to that. And, as an office manager, I trained dozens of dental assistants and I remember I was like, I need to start making some SOPs because I don't want to do this again. I don't want to like say this again. I don't want to have to go through this process again. Let's make it easier for us.
Yeah.
So I'm curious.
I ended up creating software that's customizable for offices to where they don't have to walk around with the big book and they don't have to start from square one.
Yeah.
Yeah.
And it's so beautiful. I've seen it. I've seen it from my office manager eyes. I've seen it from my consultant eyes. And I think it's so powerful. Like SOPs are not sexy. Like when we talk about SOPs, it's like, okay, SOPs. But the amount of impact that they create in the practice is insane. So I want to know because I think a limiting belief that doctors or office managers or just, leaders sometimes have is that the team revolts against SOPs or they get upset about SOPs. How did your team handle implementing checklists and implementing systems in your practice?
I have learned I have to hire a certain personality, someone that is very, um, the disc eye personality that is very impulsive does not work well. It has
Mm-hmm.
to, at least needs to be someone that is detail oriented.
Yeah.
And uh, when I hire the final candidate's going to fill out a disc so we can make sure that they've got that right fit.
Yeah.
Once you've got that accomplished, if you go into it assuring them that this makes their job easier
Mm-hmm.
and they're going to wind up looking good because the systems have their back. Instead of something goes wrong and who are we going to blame?
Yeah.
It becomes, did you use the system? Yeah. Let's look at the system. There's a system failure. Let's fix the system.
Mm-hmm.
So everybody's more relaxed.
It's so true. I wrote a mistake protocol for my practice, and we have two reasons for a mistake. It's a system error or it's a people error. And we can solve both of those things. Let's clarify the system or fix the system, or let's train the person. And so mistakes don't seem so terrifying. They don't seem so ambiguous. Like everyone's just making mistakes. And it also sets your team up to win. When you can train your team properly and they know what the answer is, they win and they
Yeah.
want to win, and it just allows them to do that. And so I just love that you've built this. I think
I
it's such a powerful story.
I teach doctors use the carrot approach to systems, not the stick approach.
Yes,
Don't punishing them, give them incentives to use the systems.
100%.
Yeah.
There's a book called Whale Done, and it talks about how to train killer whales. Like you can't force a killer whale to do anything. And the kind of the metaphor or the analogy really is like that's people too. Like we can't force people to do things. And if we do, it comes at a big cost of like lack of trust, lack of motivation. They don't stay for long. And so this book talks about exactly what you just said, how to reward people and notice the things that they're doing well so that they do more of it.
The name of the book is again what?
Whale done. Like well done, but with whale done. Yeah. I think you'd love it. So I want to change gears a little bit because you also deal with helping fearful patients. This is another one of your zones of genius. Tell me the story of why you got into teaching that. Like it's again, such a common thing. I feel like you're solving all the big problems of the industry. Why did you start doing that?
I want you to picture an 8-year-old boy that in 1964 is sitting in a dental chair and his sweet tooth caught up with him. He's got decay in 3 out of 4 permanent molars. And medicine wasn't back then, medicine wasn't what it is now in dentistry. And the boy's dentist had told his mom that it wasn't safe to numb him up because he had lots of allergies.
Mm.
And so that little boy hung on for dear life as his teeth were being drilled on.
Oh,
Do you think that would affect that boy's outlook on dentistry?
100%.
That was me.
Oh my gosh.
So
Again,
clearly the
goosebumps.
thing to do was to become a dentist, right?
Oh, yeah, right. I would never expect you to go back into a dental office after that, and you became a dentist.
But one of my motivations was I knew things needed to change, and I knew we had to listen to patients. And so that's what I teach dental teams.
Okay, I have to stop for a second and just like do like a psychoanalysis of you for just a minute. As a professional coach, I teach this skill all the time of like if there's a problem, it's really just an opportunity for us to find a solution. And you emulate that so well on your own. You see a problem and you find out, okay, let's figure out a way to make this better, make a change, help the industry, help other people. I just love that. So sorry, go on, but just wanted to really
Allison,
highlight that.
Allison, I was a slow learner.
It can't be that slow.
Had to keep making the same mistakes over and over again before I got it.
I mean, I feel like our audience probably is happy to know that because I think a lot of times dental teams, dentists are really hard on themselves. And yes, sometimes you just have to make the same mistake enough to get
Yeah,
sick and tired of being sick and tired and then make the change.
exactly.
Okay, so you were traumatized as a little boy and then you decided to become a dentist because you saw things needed to change. What happened next?
I also had to know what all those little knobs were on the dental equipment, though. I'm a nerd. It's
8 years
fashionable
of
now, but
dental school to find out what the knobs are.
exactly.
Okay, so you like how did you even start finding out how to calm our patients? And then also, what are the ways? Like, what are the techniques? What are the strategies that you use all the time or teach all the time?
The first CE course that I took out of dental school before I even had my license. Back then, you had to take the board exam and wait for the results, and you were waiting a few months. And I went to University of Louisville, and they offered free CE for students the first year they were out. The first course that they had after I graduated was on hypnosis. So
Wow.
I tried hypnosis, which honestly it requires a lot of concentration, and for a highly phobic patient, it's hard.
Hmm.
But we worked on that. We made videos back when video equipment first became available. I borrowed it from the local school that had the local cable station and did that. It requires a lot. We all are trained with nitrous oxide. It has its limitations, though. Stan Malamed, the anesthesiologist in Southern California, calls it a two-beer buzz. That helps you understand its limitations, too, for us
Yeah.
phobic patient. There's a new modality that's not been marketed much in dentistry called NuCalm, NuCalm. It hijacks the parasympathetic system and induces calm. It puts the patient in a REM state.
Wow.
Harvard studies show that it lowers vagal tone, heart rate, and it's synthesized music. The difference between here and here is 12 hertz. That's how it works. And the noise canceling out headphones also drown out the drill.
Wow. That's very cool. And so you
Any
use like based on the patient, you decide which one you want to use.
And then there's minimal sedation. Any dentist with a DEA permit can write prescriptions. They can give up to the manufacturer's recommended dose, which is not enough to put the patient to sleep, to help take the edge off.
Mhm.
Disadvantage, it may not get absorbed the same in every patient, so it's not always predictable. And then my
Mhm.
passion's IV sedation.
Mhm.
I've uh, taught it some since 2014, and now I co-own a business that teaches dentists. We've trained 3 classes now. It's a 90-hour course, but
Mm.
IV sedation is fast. It's predictable. If the patient's leery about the IV, give them that sedative dose first,
Yeah.
then they don't care that you're starting the IV.
Yeah.
Uh, and the medicines have an amnesic effect. They go in and out of sleep. It requires a residency or what I teach is a 90-hour course. We teach 32 hours of it via Zoom, 36 hours of it via Zoom. The rest are teaching uh, how to be able to do the airways, how to start the IVs. We drill them with live scenarios so they know how to handle medical emergencies and won't panic. Hint, hint. And then they have to have clinical experiences. Generally, most states require 20 clinical experiences, 20 live patients.
Got it. How did IV sedation change your practice when you started using it?
I'll give you the good and I'll give you the bad that I wish the consultant that urged me to do it didn't warn us about.
Mm,
It opens up a whole different market. I'm in rural Kentucky. I'm not in the middle of nowhere, but I can look out the window and see it. That's my world. I'm in a town of 3,000 people, okay?
okay.
They're building a school across the street from my house now, but I used to be able to look out and see cows. But I have patients. This is a county of 11,000 people. I have patients that drive an hour to an hour and a half to me because there's so few general dentists that do IV sedation.
Hmm.
It's really needed. And you wouldn't go have your tonsils out awake.
No.
No. So it's easy for patients to accept, especially the fear patients,
Hmm.
patients that gag, patients that need a lot of work done and can't take off work. It's an excellent tool. Now, the downside, I was in an office that only had 3 operatories at the time that I started IV sedation. We added a fourth, but I didn't have the capacity. And so we
Mm,
wound up replacing our patients with our fear patients. And it killed our recall program because these patients don't like to come in for their hygiene visits as much.
right.
So I not only I teach dentists how to do this stuff, but I also will coach offices on how to be able to implement it profitably in their office as well, so that they don't get caught with the traps that I did. If there's been a mistake made, I've made it.
I love that you're so candid about it as well. It's just, I think that's what we really want. Like this is Dentalflix Uncut. We want to know the like the pros, the cons. Like there is a consequence to everything we do. And sometimes we just don't know it until we do it. And so I think that's so helpful. Um, I remember I worked as a dental assistant in my very first practice in my practicum, and the doctor did IV sedation. And I found it as a dental assistant very relaxing. You didn't have that like sense or that fear for the patient when we're doing wisdom teeth extractions, when we're doing, full mouth extractions in the practice that I was at a lot. And it was like just very, like, it was very peaceful for the patient. And so as a dental assistant, I remember it being really lovely to be able to be in a practice like that.
One of the things I teach in my courses too is how to use OTC meds. I can routinely 98%. I do a fair amount of full mouth extractions. I'm in Kentucky. By the way, Kentucky and West Virginia vie for the award on who invented the toothbrush. Were
No
you aware of
way.
that?
I
Yeah.
was not.
Yeah. Any other state, it would have been the teeth brush. Audible. I'm surprised you've never heard that before.
No.
Um, I lost my train of thought with that though. Get me back on track.
Oh my gosh, I lost my train of thought too because that was just funny.
I do a
Oh,
fair amount of full mouth extractions.
yes.
I'm able to do with the techniques I teach, I'm able to do 98% of them with no narcotics, and the patients brag at how well they get along.
Wow.
And I need to put that course on Dentalflix.
Yes,
Make
you
it happen.
absolutely
Yeah.
you absolutely do. And I mean, right now you have a fantastic course on Dentalflix. And it's called Relax. This is going to be easy, and it talks about how to treat and like the difficulties treating fearful patients. So everything we talked about today, but like deeper, you go like really into the details of everything. So definitely go and check out Dr. Moorhead's course. It's fantastic. He's obviously a great presenter and hilarious. So you need to go and watch this video. And you bring a lot to our industry. You do a lot. And I think anybody that thinks like, this is a problem. I'm not going to like live in it. I'm not going to sit in it. I'm going to find the solution. Those are the people that I think are changing the industry. So I would love to hear from you, just with your wealth of knowledge, with your experience, anything else that if you could like go back in time and be a dentist, at the very beginning of your career, but you knew everything that you knew now, what would be some of the things that you wish you could tell yourself at the beginning of your career, but like with your brain and knowledge now?
I probably wouldn't have come back to a small town. I have enjoyed it here, but it's held me back too.
Mm,
I grew up in a town of 600. So
wow.
I played it safe and went back to what I felt comfortable with.
Yeah.
And I love the small town, but uh, I could have grown so much faster if I had been in a suburban area, something like that. So that's one. I would have implemented. I didn't do a residency. I've been in practice since 81, so I'm ancient. But I didn't do a residency, and I didn't start learning the advanced stuff for about 17, 18 years. And then the bug got me, and I went to dental boot camp, which was run by Walter Haley, who's since deceased. His business partner was Steve Anderson, who's in Dallas and runs a consulting program. But I learned verbal skills, and they encouraged dentists to up their game on CE. And so I did the Dawson track of stuff. I learned the IV sedation, and I've just been a CE junkie. I wish I would have started that 15 years earlier.
Hmm. Yeah, I think that's something that I think is just so incredible. And one of the things that we're trying to accomplish with Dentalflix too is just making education so accessible. Meeting people like you on an online platform that, they can get more information, they can get support, they can get your software. It used to be where we had to go to a physical meeting to, learn these things. And now it's so accessible to us. So I just encourage people to never stop learning because you get your whole career to just continue to advance yourself. And that's part of the fun of it, I think.
Yeah, we still really need the live courses, but
Yeah.
one gift that COVID gave us was the opportunity to do all the things that we do online nowadays.
And normalize it and not be afraid of it. So yeah, 100%. Okay, so not moving back to a small town, keep learning, keep being a CE junkie. What else?
I've never learned to place dental implants. And at my age now, it's hard to justify learning that for the number of years I'd be able to use it, but I would have done that. And
Mm,
sedation pairs so well with dental implants, and those two things, doctors can make you a heavy hitter.
yeah, absolutely. And I think now, like in our modern day, people are looking for dental implants way, way more, than ever. It's so common. People want to replace their missing teeth. It's a very big procedure that people are getting done.
And then going back to the systems, a big thing that I would have changed. Doctors come out of school and they expect the people that are working for them to think at a doctoral level.
Mm,
So we're going to hire dentists to work for us as assistants. That's not affordable, but we expect them to think like us. That's the advantage of the SOPs, the standard operating procedures, is you can put it at a level to where it's easy to understand, alter it if it isn't, to where you can be able to engage the team. I want to give you
yeah.
an example. I have in my StreamDent software, I took every question that we ask on the medical history, every yes, no question. Do you have diabetes? Are you pregnant? Do you have asthma? Doctors, you have in your head the questions that you're going to ask to follow up, but they're always in your head. You've never bothered giving them to the dental assistant. So I put all of those in the software to where they can click, and if the patient has diabetes, they know to ask, what type is it? Is it insulin dependent? What medications do you take? What's your typical blood glucose? What's your A1C? If they're asked, the questions that the dentist knows to ask can all be delegated. And with the polypharmacy, they're becoming lengthy conversations. It's still going to take chair time, but if you can move that time to where the dental assistant can do it, number one, they feel empowered, they are more valuable, and doctor, you get more done.
Oh my gosh. Yes. 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 I remember being a dental assistant and I was like that like high performing dental assistant that was like always bored. And my doctor kept me in the practice for 10 years. I mean, five of it, I was an office manager, but I stayed as a dental assistant because I was being taught all the time, being taken to CE courses. He would ask me, like, what do you think this solution is? Like, what would you diagnose? Like, he kept me so engaged and I learned so much. It was so much fun. I had such a rewarding career. And I think sometimes doctors like estimate the impact that they can have on a person when you're really willing to teach them. And when you put these things into SOPs, it's not as like mind exhausting to have to like, let's sit down and we're going to do a lesson today. It's like, it's all written out for you, what questions you have about it. So I just love that. And my one question I wanted to ask you even before we got on this podcast was, what was the inspiration for you to treat your team the way that you do? Because you take good care of your team. Like you empower them, you believe in empowering them, you believe in helping them win. You've obviously done some leadership work. And that I know is not taught in dental school. So, what was the kind of inspiration for you to be this leader in your practice that takes such good care of their team?
You're going to expect this answer and you're not going to expect this answer.
Okay.
Making the same mistake over and over again, doing it the wrong way. Um, Expecting too much out of them, expecting to think like a dentist, uh, not praising the typical dentist. I was one of them, came out of school, perfectionist model that
Mhm.
that has high standards for themselves, too high standards, not accomplishable, and everybody around them. And then negative reinforcement. I came out of school, it's still this way today, some, but not as bad. Everything I learned in school, it was negative reinforcement. The instructors wanted to find what was wrong, and it took me years to get past that.
Mm-hmm. Yeah, and we have like a mental health crisis in our profession. And I wonder how much is because like when you're trained in dental school previously as well, that a lot of it is like that perfectionistic mindset. It's just a lot of pressure for you. And it's the idea that everything has to be perfect. So I think that's fantastic. That thank you for being so vulnerable as well with like all of your answers and just
I
all of
hope
the ways.
everybody learn from what I did so that they don't have to go through what I did.
Yeah. And this is why mentorship and learning from people is so valuable. Like we don't have to make the same mistakes other people did. We just simply don't. There's some mistakes maybe we do, but not
Mhm.
all of them. So, Dr. Moorhead, tell us about how people can work with you. I know you mentioned your software, you've mentioned your IV sedation course. Like what else? Or dive deeper into those so that people can know how to work with you, connect with you, and really get your support.
For coaching, and my last name is phonetically Moorhead, Moorhead. No E after the R. So on my website for coaching and speaking is drmoorhead.com. There's tabs on there for coaching. There's my StreamDent website that sells the software, the SOP software. If you look at it, doctor, you're going to be pleasantly amazed at how affordable it is. I have designed it so that it is a no-brainer. And I'm gonna backtrack and not talk about resources so much. I hear from offices, but I don't have time to implement it.
Mm,
If you take your pain points, and a GP office on average does 10 procedures, that's 90% of what they do every day, all week, all year. If you work on SOP, customize SOPs for like 10 procedures, and I've developed a relational database. When you update it one place, it asks you if you want to change it every place else. So it builds on itself, and it's not a lot of work to be able to customize. That's streamdent.com, STREAMDENT, streamlined dentistry. For dentists that might want to learn IV sedation, we're now okayed in 12 out of 48 continental states to teach IV sedation. As far as California uh, to Georgia, we're based in Kentucky. That's uh, I designed the website because it's easy in the company name because it's easy for self SEO. IV sedation training for dentists.com.
Perfect.
My Google Voice number that reaches my office and my cell is 502 509 1570. And my email is dr.m, Dr. Moorhead, at streamdent.com.
Love it. Dr. Moorhead, thank you for being a creator. Thank you for being you. Thank you for making us laugh today. And thank you for all the solutions that you brought forward in your dental legacy. And I highly encourage any one of you to reach out, um, learn from this man, because again, you don't have to make the mistakes that he made. You can learn in a streamlined way, you can have less stress, more fun, and take better care of your patients. So thank you for being on Dentalflix Uncut today, and we will see you on another episode.
Thank you, Allison.
You've just unlocked valuable insights with Dentalflix Uncut, but there's more. Dentalflix is not just a podcast, it's a thriving community, a hub of knowledge, and the #1 online streaming CE platform in dentistry. With just a few clicks, you can start exploring a wealth of resources, including in-depth training on leadership, case acceptance, scheduling, hiring, weekly marketing calls, insightful gap assessments, and scorecards, all designed to help you master what you discovered today and propel you further on your path to dental excellence. Head to dentalflix.com to get started for free and embark on your journey towards mastery. Thanks for tuning in to Dentalflix Uncut. See you next time.